How to recognize the early signs of autism. Early intervention is important for children with autism, a developmental disorder that inhibits socialization, so be on the lookout for warning signs. You will need knowledge of developmental milestones and careful attention to your baby's behavior. Optional, a hearing test for your child. Do not assume that if your baby exhibits behaviors associated with autism, they necessarily have the disorder. Observe them carefully and bring any concerns to a doctor. Step 1. Pay attention to when your baby begins to babble. They should start at around 5 months old. Step 2. Begin monitoring eye contact at around 6 to 9 months, when infants generally start smiling in response to their parents' grins. Babies with autism tend to avoid looking at their parents. Step 3. If your baby makes a sound, make one back and see if they reciprocate. Babies with autism usually do not take part in this verbal turn-taking, nor do they participate in peekaboo. Step 4. Note whether your baby responds to their name. They should begin to do so starting around 10 months. Babies with autism often ignore people trying to get their attention and don't solicit anyone else's attention. If your baby ignores you when you call their name, get their ears checked. They might have a hearing impairment. Step 5. Note their behavior around 12 months. By this point, most babies are pointing, waving, grasping objects, and attempting to speak. Step 6. Gauge your baby's sensitivity to sound and touch. Many children with autism are unusually sensitive to loud noises and hate being cuddled or touched, yet they sometimes underreact to pain. Step 7. Note their focus. Do they tend to fixate on a favorite object or part of an object to the exclusion of other people, including other toddlers? Step 8. Look for repetitive movements associated with autism, such as rocking back and forth, hand flapping, and twirling. Step 9. See how set in their ways they are. Children with autism often exhibit strong resistance to changes in their routine. Step 10. Keep track of their vocabulary. At 18 months, most babies can say about a dozen words, and by the 2-year mark, they're usually initiating 2-word phrases. Step 11. Some children with autism seem to develop normally until 18 to 24 months, then stop or regress in speech and other growth. Consult your pediatrician if your child regresses or if they exhibit any of the behaviors previously discussed. Did you know? Canadian researchers have found that the intelligence level of people with autism spectrum disorders has been underestimated, and that many of them could excel at highly structured jobs in math, science, and law.